So the purpose of my bit is talking about what is psychological therapy. Psychological therapy is a term that we use to describe somebody giving support in the form of a talking therapy. There are lots of different types of talking therapy that aim to help young people who are struggling with a range of emotional and mental health difficulties, such as stress, anxiety, depression, anger, psychosis, obsessive compulsive disorder, known as OCD, eating difficulties, self-harm and suicidal thoughts. So sometimes when I speak to young people, they struggle with therapy because they're worried that they're going to be judged when they come to therapy. So they often feel worried and scared. And although they want therapy, these can get in the way of them coming. Psychological therapy is a place that is collaborative and that you're talking about the things that you want to talk about, that you want help with. So young people often ask me, what does psychological therapy involve then? It involves a therapist who is trained in giving that particular therapy. A therapist is a good listener, they're compassionate, empathic and patient. Your needs are important, so we want to make sure we give you the time to talk about difficulties that are important for you. We always encourage young people to talk to their friends and family because we value that it's important to talk, and so you don't keep the feelings to yourself. But we're also aware that these are the people that surround your life most of the time, and sometimes you need that person to give that more subjective view on your difficulties, whereas family members, we can worry about upsetting them or whether what we're going to say is going to affect them in some kind of way. So it's important to note that psychological therapy is always confidential, and what we mean by that, what we talk about stays between you and the therapist. But we also say to young people that if there is a risk to yourself or others, then we have to break that confidentiality. What you talk about in the therapy is up to you, and so it's collaborative in that way. So you'll decide therapeutic goals in which you want to focus on. The therapy will go at the pace that's right for you. How does psychological therapy help? There are lots of different types of psychological therapy. And although, depending on what type of psychology you have, will obviously focus on different areas, but they all generally share the same common goal. They want to know what are the difficulties, what might have made the difficulties develop or start, but also what's gone in your life that's made them particularly worse. And I suppose the aim of therapy is to increase your understanding or awareness or insight of your difficulties and offer new strategies or new different styles of coping or thinking, and hopefully change the way that you're living your life in a way that you want to live your life. So when I meet young people, they often ask how long is therapy and what is it going to involve. I suppose depending on the type of therapy, it can range between 6 and 50 sessions. It could be even more depending on what type of difficulty you have. Some therapy can involve more than one person, so it's not just you in the room. It can involve family members, or it could sometimes involve a social worker or a teacher, depending on who you find important in your life can be in the room as well. So it can be on a one-to-one base. Sometimes we offer therapy that's in a group setting. We can offer it over the telephone, we can offer it over the internet, maybe using things like Skype. So I hope what I've talked about has been helpful, but I think the one thing I want to finish off with is really saying we all have the ability to make small changes. And sometimes we need that one person to be alongside that journey to help us make sense of those difficulties so that we're not left alone dealing with them. So hopefully this might encourage you to maybe give therapy a go if you are unsure whether or not to